Welcome to AFD TV. I'm your host, Athada Samajala, and here with me today is Nurse Amber and Dr. Sam, here to talk to you about breast cancer. October is the Breast Cancer Awareness Month. Did you know that 1 in 8 women will develop cancer? And men can develop breast cancer too.
Early detection is the best prevention. It is very important to do self-exams and stay up to date with your yearly physicals.
Get your yearly mammogram. Every October, most imaging facilities offer discounts on mammograms to encourage more women to get these done.
For the month of October, AFD will be donating $1 towards breast cancer awareness. For every Facebook like, go to our Facebook page and like us to help support for this cause.
That Facebook page is facebook.com/AFD clinics. So Amber, what about screening with genetics?
Yes, there is a screening test that they can do with genetics now, and that is called a BRCA1. And that's a test that they can do, and it shows that over half the women that actually have this gene, by the time they're 70 years old, will more than likely have breast cancer.
It's a very reasonable test to ask your doctor about.
Correct. We even do it in our location.
We do.
Mm-hmm.
And more insurances are covering it.
Mm-hmm.
The price is going down. A lot of labs will do the prior authorizations. For anyone with significant family history, Eastern Europeans.
Yes.
However, it's actually been shown now that it's reasonable for all women to inquire about getting tested.
Absolutely.
Because yes, it's more common in some genetics. However, we're also seeing mutations in the overall population as well also.
Absolutely. What age should we be getting a mammogram, Dr. Sam?
Age 40 to get your baseline mammogram.
Wonderful. Are there other tests besides mammograms that they can do?
Well, there is. MRI
Mm-hmm.
is a good test for women who tend to have either more fibrous breast tissue, or of course if they've had implants,
Mm-hmm.
then that's really the gold standard to get a breast MRI. And also the nice advantage of a breast MRI is no radiation.
Mm-hmm. And less pain.
And less pain, yeah. But the concern, of course, is the cost as well.
Okay, wonderful.
So, and also the good news now with early detection, the treatments are improving. So
Should we still be doing monthly exams at our homes?
Yes, I recommend it. And better to be on the safer side than not. I mean, 1 out of 8 women is quite a lot, and even men as well too. Men, although it's less likely, I mean, as with the aging population and actually more overweight men, men are developing more breast tissue as well, which can increase our likelihood of developing breast cancer also.
Yes, absolutely. Is breast cancer the highest cancer that women, the highest, I guess, number that you can get?
Yeah, I mean, as far as for death rate, it's not.
Okay.
And as far as incidence, I mean, actually, the death rate is going to be lung cancer.
Okay.
Yeah, it's still going to be smoking. And yes, you could get lung cancer without smoking, but, why do anything to ourselves that we know will increase our rate of cancers in general?
So I know that smoking, obesity, and then also using some of the hormone medications can increase the chance of breast cancer. Is that correct?
Correct, yeah. And there is some talk and theories about antiperspirants versus deodorant. Antiperspirants have aluminum in there, which literally blocks the sweat glands in our underarms, and who wants to put a heavy metal in our body if we don't have to? Deodorants, yes, it may just mask the odor, but again, it's not a heavy metal. A lot of times women and men will sweat less if they remove their hair in their underarms, and also or get laser hair removal for their underarms. But
that's a good idea.
But there's obviously a link between breast tissue and our lymph nodes under our underarms, and so less chemicals we expose ourselves, the better.
Awesome.
So take it away.
Thank you for watching AFD TV. See
you next
soon.
time.
AFD TV is designed to provide an educational discussion about current medical topics. For a personalized medical opinion, please consult your primary care physician or visit one of America's Family Doctors clinics today.